I am glad to welcome you to HDRA Channel 1 Oncha, the Human Rights Defender. Our focus today is on the increased high rates of drug abuse, intake of substandard and empirical drugs. From our observations, we could find out that high rates of deformity and holistic mortality in Nigeria per se is fingered to massive consumption of fake, empirical, and wrong prescription of drugs. Therefore, we are calling and pleading to the President, Bola Ahmed Tinubu, Anambra State Governor, Professor Umar Charles Soludo, and other 35 state governors, and to whomever it may concern, to help and team up and marshal out anti-drug abuse agency, irrespective of the existence of NAFDAC. With me for the program today is Dr. Anthony Ikechukwu Idumog, the President and National Coordinator of Anti-Drug Movement International Incorporated, and Pastor Bengret Eduno, the Lead Counsel, Human Dignity Restoration Association. Over to you, Buchi Emesiani of Odenibo, 99.1 FM.
Of Anti-Drugs Abuse Movement International Incorporated organization worldwide. Nyamabukwa National, also Deputy National Controller, Safety and Rescue Emergency Response Services Incorporated in Nigeria. Obukwa the Medical Director, Sunshine Integrated Hospital, number 4 Obanye Street, Onitsha. Yes, if I know about Otuesi Emir and Agama Cho Ki Genti, Barrister Benjamin Eduno, Boyen General, Norine Makanke Tata.
Dalono, Ndebanye Kaino Liano.
And Mekenekwa. Dr. Godpower Idimsi, Boyen Kebo, the Medical Director, Sunshine Integrated Hospital, number 4 Obanye Street. Dr. Norine Nanketata.
Thank you, Bichi. Yeah, good evening, everybody. I welcome to Justice Arena Funny program on Odenibo radio station, 99.1 FM, Abuja, Anambra State, Nigeria. Sponsored and coordinated by International Registered Human Rights Organization and Anti-Drugs Abuse Incorporated Headquarters and Social Integrated Hospitals, 4 Obanye Street, Onitsha, Anambra State, Nigeria. We are with tandem to discuss our legal rights issues and our health issues as it relates to drugs abuse matters, drug abuse and misuse matters, including health-related matters associated with iatrogenic and nosocomial lymphatic disease due to what we call infection resistant to drugs in both male and female, married or single, young or elderly in our society today. So the health education segment of today will be on how to prevent the high rate of morbidity and mortality in our society due to what we call drug abuse and misuse, scientific authorization about concussion misuse in the treatment of disease and infections, later health complications, either communicable or non-communicable, in both male and female, including child life in the womb after conception. Treatment of malaria. So in that publication, we see that the writer, it was published for the purpose of how to make the public understand that taking any herbal concoction over the counter drugs abuse can create disastrous effect to the developing what we call a child development in the womb and create some deformities or abnormalities. Something like what we call cliff lift, emendegafu, ono ha gbawa na ekiti elu. Ụfọdụ ha ga-ekwu okwu, that is a club palate. Then club feet, emoni ga-afụ ife amụọ ya, okwe ya ahịa. Then under the hair lip, he land under clip palate. Congenital heart conditions, as second as na amụrụ nwatakịrị obi ya ada function of ma. Ọ bụrụ ụmụ concussions ọ ṅụrụ mgbe nne ya dị ime. Nne ya ṅụrụ mgbe ọ dị obi ya n'afọ. Then ihe niile na-deform babies. It also affects the what you call sexual organs, including spinal cord defect. Emụrụ ụmụaka ọ na-abụ mechaa. It may have affect the sexual organ. Ihe ha ji eburu nwoke ma ihe ha ji eburu nwanyị. Conjoined what we call twins. ndị ga-eweta obi ahịkọ ma ọ weta azụ makọ weta okwu hịkọ so unu ga na-anụcha ihe ndị a. Ọ ihe ndị a mere anyị ji wepụta okwu a tata. And reference ọzọ bụ nke a agba ha na pepa. Kama somebody called me on 6th, 7th, yeah, yesterday, around 7:32 p.m. in the night, requesting for a drug made by the Anti-Drug Abuse office, and then the name in tag about the what you call the sachet, because I happen to question the woman. How does the packaging on the drug looks like? Also on the sachet. And Dr. Anthony Kechukwu is Dr. Dimog, written on the sachet with his own anti-drug abuse phone number. So we use this opportunity because having detained me, telling me that she bought the drug meant for infection treatment at the tomato market near Army Barrack, Onisha. But when I wanted to question her more, she declined. She didn't want to speak again. And the phone number is this: 091 63 220 331. So wherever the woman happens to be, either in Orumba, anywhere, whoever knows this number can contact her. Let her phone to this number now that we are moving for what we call informing the government, both state and federal, that all these things, if drugs are not regulated in this country, mainly in Anambra and other sister states, Imo, Abia, Delta State, near the Anti-Drug Abuse National Headquarters, it's uncalled for. So now, the lawyer will come in to address you people and tell you more about Act, Poison Act of 1933 and Poison Act of 1972 amended. So, Barrister, you are welcome.
Thank you.
Aka na aba wogi ofu aka ejenga eza ajụjụ ya. Impersonation bụ ofu ije wala afa mmadụ wee na-ebitọkọ nke abụgodo ofu ana even fota from ife Dr. Gospel Idim Sikwu ọ bụ njọ bụla arụ dịrọ mma. Barrister Benjamin Eduno, no.
People, you're out there listening to this program on daily basis because what we are doing here is how to give a better life to every one of us. And thank you so much, Doc, for doing justice to that particular part. Today, I have a case file. And the case file is related to what Doctor just mentioned. And anything about health is very, very paramount. It's very, very important. Many of us may not actually digest everything Doctor said. I want to start from there. Then I talk about the positions of our law. And we're going to provide some advice to the person that's sending this message. Now, what Doctor is saying is this. Somebody called him on phone and the person reported about a particular product in the market. And that product, according to the caller, was manufactured by Doc, packaged, and on that product, his name and phone number was boldly written on it. Then the person was requesting for that particular substance or drug. And Doctor was surprised because Doctor don't have any product. He don't produce any product in the market. And this is very, very vital. And by this, he's issuing a kind of disclaimer. Now, if you are listening to us out there and you find any drug, any substance, whether sachet or in a liquid form, syrup, or in any particular form or tablet, as the case may be, bearing the phone number of Doc, even by extension my own phone number, who knows, let it be known to you that we are not advertising any drug here and we don't produce any. what we are saying, what we are clamoring is to warn people, individuals, those selling fake drugs in the market, those producing drug without license, those producing poison which people are consuming and people are dying, and today we have a very high rate and increasing high rate of infant mortality. So what are we saying? You know, this drug now, people might have been consuming it in the market, and who knows how far this product must have gone into the market and the substance. Oh, we can one day get somebody be a blue mother, so no dog who produce, and then look at what is happening to the person. So doc is shouting it loud and clear that he don't have any product in the market bearing his name. The person that called and requested for that product he bought bearing doctor's name, please, I hope you are listening to us. Please, 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 that product is not from doc, and we are warning our people. This issue of buying drug from unauthorized sellers is very, very dangerous.